Tallahassee Sierra sobs as she recounts how, as a middle schooler, she helplessly witnessed her mother's downward spiral into drug addiction, an affliction that left Sierra at times wishing her mother would simply die to end their suffering. Now 20, she is one of the countless child casualties of an opioid epidemic Florida lawmakers are struggling to curb. With a 35% jump in opioid-related deaths in 2016, legislators are considering options to stop the spread of drug addiction and to keep patients from getting hooked on prescription medicines that can lead to the use of even more lethal heroin and fentanyl. Policymakers are focusing their attention on drug users, dealers, and doctors. But child welfare advocates want to make sure that the needs of wounded children and other family members aren't forgotten. On the surface, what Sierra experienced growing up with an addict for a mother pales in comparison with the tales of children discovered in the back seats of cars with their parents passed out from drug overdoses in the front, or toddlers left alone in fetid apartments for days while drug-addled mothers or fathers scour the streets for a fix. But after her mother, Elizabeth, became hooked on pain pills due to back pain, life as Sierra once knew it rapidly changed. The electricity would be disconnected. The water was shut off. Money would disappear. The family, Elizabeth, her boyfriend, Sierra, and Sierra's younger sister, began to move from place to place. Sierra finally realized her mother had a drug problem. It got worse and worse and worse, so it's kind of unhideable after a certain point, she said. Sierra and her mother requested that their last names not be published. Teenagers and tweens with drug-addicted parents may not have to enter the child welfare system because they are not as vulnerable as younger children, who are dependent on others to provide basic necessities. As the numbers of addicts escalate, the numbers of children placed in out-of-home care because of parental drug abuse is increasing, according to data captured by the Department of Children and Families. We've definitely seen a significant increase in the number of kids who are coming in the child welfare system as a result of parental substance use, said Jen Petion, Director of Administration and External Affairs for Families First Network of Lakeview in Pensacola, an agency that provides foster care and other services. The statistics are staggering across the state. More than 4,000 babies were born addicted to opioids in Florida in 2016, an increase of over 1,000% from a decade ago. Substance abuse played a role in 2/3 of the cases where children were removed from their homes within 30 days of birth last year. And there's been a 38% increase in the number of children under the age of 5 who have been removed from homes because of substance abuse in the past 4 years. The influx of children has resulted in a shortage of foster care beds, Petion said, prompting her agency to hire an additional foster care recruiter. Gov.